Welcome to Sustainable Health Empowerment's Health Education Series. I'm Mark Bannikin. I'm an internal medicine resident at UCLA Oliveview. Objectives. Number 1. Identify risk factors for various cardiovascular diseases and disorders. Number 2. Identify symptoms of cardiovascular disease, but recognize that there may be no symptoms in the beginning. Number 3, identify medications and other treatments for cardiovascular disease. And number 4, recognize what you can do to decrease your risk of cardiovascular disease. Let's review what we discussed last week. Here is a summary of conditions and risk factors for cardiovascular disease. High blood pressure can thicken and narrow vessels and is one of the biggest causes of sudden heart attacks and strokes. High cholesterol leads to a buildup of plaque and thickening and narrowing of the arteries. Having diabetes increases the risk of heart attack and stroke. Smoking harms both the heart and the lungs. A diet high in salt, fat, sugar, and cholesterol can also increase your risk. Getting old increases the risk of narrow and damaged arteries, and a weakened or thickened heart muscle. Obesity increases other risk factors. A family history of heart disease increases your risks, especially if a parent developed it at a young age. Drinking too much can increase your blood pressure and triglycerides, which are a form of cholesterol. In our next 8 episodes, we will be exploring in depth both hypertension and stroke. For now, let's look at the symptoms that you should be aware of. One important thing to note is often there are no symptoms of the underlying disease. The first heart attack or stroke may be the first sign. Some common symptoms of heart attack are chest pain or discomfort in the arms, left shoulder, jaw, or back, shortness of breath or trouble breathing, and nausea. Women can also have different symptoms such as vomiting or stomach or abdominal pain. Some symptoms of stroke include numbness, confusion, an inability to speak clearly, drooping of one side of the face, loss of balance, dizziness, or a severe headache. In babies, bluish color in the lips or fingers, fatigue, sleepiness, trouble gaining weight may be signs of congenital heart disease, otherwise diseases that these babies are born with. In adults, they can have chest pain, fever, shortness of breath, cough, rash, or unusual red spots, which may indicate an infection. In heart valve disease, many with heart valve disease have no symptoms until they are middle-aged, and then begin to present with shortness of breath when working or lying down, swelling in their legs, and fatigue. Problems with the heart muscle, also known as cardiomyopathy, is when the heart muscle's ability to pump blood is affected. A person may have breathlessness, dizziness, fatigue, fluttering or rapid heartbeats, fainting, or swelling in the legs or feet. If you experience any of these symptoms, please be sure to see a doctor. It's important to remember that for those with cardiovascular disease, that there are medications to reduce the risk of heart attack or stroke. These medications include aspirin, an antihypertensive or a blood pressure lowering medication, and statins, which can lower your cholesterol. Let's have one final review of important lifestyle changes that can protect you. Certain types of cardiovascular disease, such as congenital heart defects, cannot be prevented. However, you can help many other types of heart disease by making the same lifestyle changes that can improve your heart disease, such as preventing or treating and controlling high blood pressure, preventing or treating and controlling high cholesterol, preventing or controlling diabetes, not smoking or using tobacco, maintaining adequate physical activity, which is going to be about 30 minutes a day most days of the week, maintaining a healthy weight, eating a healthy diet that is low in salt and low in saturated fat. Remember, persons can be treated for conditions or risk factors should follow the guidance of their healthcare providers. This week, we have discussed the risk factors, symptoms, and treatments for various cardiovascular diseases, in addition to talking about how you can reduce your risk for cardiovascular disease. Thanks so much for tuning in, and be sure to check out our next episode and all the episodes in this health series on our YouTube channel at Sustainable Health Empowerment.